What does a neurosurgeon do in stroke surgical clipping? Imagine a tiny, fragile balloon inside your brain that's at risk of bursting and causing a stroke. When that balloon is a brain aneurysm, a neurosurgeon steps in to help. In stroke treatment, especially for bleeding caused by a ruptured aneurysm, surgical clipping is a key procedure. The neurosurgeon's job is to prevent further bleeding and protect the brain from damage. First, they carefully evaluate the patient's condition. They look at the size, shape, and location of the aneurysm and decide if surgical clipping is the best option. This decision depends on whether the aneurysm has already burst, causing bleeding in the brain, or if it's at high risk of rupturing in the future. The neurosurgeon considers all these factors to plan the safest approach. Once the decision is made, the patient is given anesthesia so they are completely unconscious and pain-free. The surgeon then makes an incision in the scalp and carefully removes a part of the skull, known as a craniotomy. This creates a window to access the brain. The size of this opening can vary. Sometimes it's a larger cut, but in many cases, a smaller, minimally invasive approach is used to reduce recovery time. With the brain exposed, the neurosurgeon uses a high-powered microscope and advanced imaging tools to locate the aneurysm precisely. This step requires skill and precision, as the surgeon must avoid damaging nearby blood vessels and brain tissue. Once the aneurysm is identified, the surgeon places a tiny titanium clip across its neck. This clip acts like a barrier blocking blood flow into the aneurysm sac. By doing this, the aneurysm is effectively isolated from circulation, which prevents it from rupturing again or bleeding further. During the operation, the neurosurgeon continuously monitors blood flow in the surrounding arteries. They want to make sure that the clip is correctly placed and that normal blood flow is maintained. Live imaging and blood flow measurements help confirm that the aneurysm is fully excluded from circulation without harming nearby structures. After the clipping is complete, the surgeon carefully closes the skull opening and stitches the scalp. The patient is then moved to intensive care, where they are closely watched for any signs of complications or neurological changes. Post-operative care is crucial to ensure recovery and to manage swelling or other potential issues. The neurosurgeon also oversees follow-up care, which includes imaging tests to confirm the aneurysm remains sealed and to check for any new problems. Surgical clipping is known for its durability and low chance of recurrence, especially for aneurysms that have already bled or are at high risk of doing so. In essence, a neurosurgeon's role in stroke surgical clipping is to perform a delicate operation that places a tiny clip on the aneurysm's neck. This prevents blood from entering the aneurysm and reduces the risk of a future stroke caused by bleeding. It's a complex procedure that requires expert skill, careful planning, and precise execution to protect the brain and improve patient outcomes. Always remember, if you or someone you know faces this situation, consulting a specialized neurosurgeon is essential for personalized and safe treatment.